advised when we have an outbreak of virus, such as the norovirus. Norovirus does not respond to hand gels or alcohol, so you need to hand wash when we've had an outbreak or we are aware of that. We also need to use soap and water when our hands are visibly soiled. And when you're going to be preparing your foods at home, you should be washing your hands with soap and water. And of course, before and after you go to the restroom. So when you wash your hands, it's very important to first wet your hands with water. And you're going to be applying soap. It can be either antimicrobial soap or non-antimicrobial soap. And you're going to put it in the palm of one hand. And before you stick your hands immediately under the faucet, what do you need to do? You need to rub your hands together vigorously for at least 15 to 20 seconds, making sure that you're covering all the surfaces of the skin on your hands with the soap. And also the vigorous rubbing will help loosen the soil and the bacteria. Then you can rinse your hands under the water. Dry with a disposable paper towel if you can, not a towel. And then make sure you turn the faucet off, but make sure you use the paper towel to turn off the faucet and also to open the bathroom door when you exit. So it's important, most of all, to remember just to make sure that you perform hand hygiene right at the point of delivering health care to our patients, at the point of care. And there are 5 moments that you should perform hand hygiene. Can you tell me what they are? When are the 5 times that you should be doing hand hygiene?
Before and after restroom. Before you do a meal.
Okay, before touching a patient, right?
Right.
And what else? Before you're performing an aseptic procedure, such as a nurse that's going to draw up on something in a syringe, you should be washing your hands. If you've had exposure to any bodily fluids from a patient, if you've touched a patient or any of their surroundings, you should be washing your hands. Okay? All right. And if you can, you should try to perform hand hygiene with an alcohol-based formula, because why? It's right there. It's accessible to you. You're more likely to use that than you would soap and water. But you should try to use soap and water when your hands are visibly soiled. All right, some of the other things to remember with hand hygiene is that we shouldn't be wearing artificial nails or extenders when we're taking care of patients. And you should keep your natural nails at 1/4 inch in length. You can use nail polish, but you want to make sure that it's not cracked or chipped. And it's really good not to be wearing a lot of jewelry when you're doing hand hygiene. And you want to remove gloves after taking care of a patient, and don't use the same pair of gloves for more than one patient. We've got lots of gloves here in the health department. That's what they're for. And you don't want to try to wash off your gloves or wash them out after you use them. All right, I used this last year and I heard lots of groans, but I like it. This is hard to see, but it's pictures of, to just kind of tell you how important hand washing is. This is a restaurant worker in that first shot, and he is at work, and he becomes acutely ill while he's at work. And he starts having some maybe nausea and vomiting and maybe some diarrhea. And when he begins to feel a little bit better, he gets up and he goes back to his workstation. He can't miss work. You know, if he's not at work, he's not going to get a paycheck. So he goes back and he starts prepping food. And in this instance, it looks like he's going to be making a salad for a customer. So he starts cutting up the tomatoes, and then he moves over and starts cutting up the cucumbers, and he compiles this salad. And the waitress comes through the window, and she picks up the salad and takes it out to the customer, who happens to be, looks like a young lady there. And she eats the salad. So the next day, she becomes ill with the same symptoms that he had. Looks like some abdominal cramping, nausea, maybe some vomiting. She and 12 other people became sick from that one restaurant worker who probably just didn't know or didn't understand about the need for proper hand hygiene He didn't know to wash his hands when he came out of the bathroom or wear gloves when he was preparing food. And I feel like here, this is a perfect example as a restaurant manager where, restaurant managers need to really teach their servers and their workers about proper hand hygiene. But it's kind of a risk that you take when you go out to a restaurant. You never know if the people preparing your food have used proper hand hygiene. A good sign to be, I always tell my children as I go in the bathroom, and if there's no paper towels in the bathroom or no soap in the dispenser, they always slide under the chair at the table because I go out and ask for the manager, and I'll say, where is the soap and where's the paper towels? And they kind of look at you like, and then I say, I'm a public health worker from the health department, and they don't like that. And it makes them think maybe. All right, let's move on and talk about some of the personal protective equipment known as PPE. And you can see some of these things that we use here at the health department, our masks, our gloves, our gowns. These are things that we use to have a barrier between ourselves, our mouth, our skin, our nose, and our eyes, and potential infectious materials. And when they're used properly, they can prevent the spread of infection from one person to another. Here again are just the examples. All right, now we're going to move on to respiratory etiquette or cough etiquette. And this is a good visual picture, I think. It shows you that someone has either coughed or sneezed, and you can see all of the little droplets going out into the air. So we know that you can pass things like influenza, whooping cough, by just coughing or sneezing and pushing that bacteria into the air, and also our hands that are unclean. And especially if you've got lots of people in crowded places, that's a good way that things can spread easily that are airborne. Okay, respiratory etiquette. The pictures here show different things that you can do. When you cough, you need to cover your mouth and nose with a tissue and throw the tissue in a wastebasket. If you don't have access to a tissue, a napkin, you can always cough into your sleeve, not your hand. If you cough into your hand, what are you doing? You're potentially contaminating everything that you touch, the telephone receiver, the keyboard, the doorknobs. So you're passing germs on to other people. After you cough or sneeze, always clean your hands. Use hand hygiene, soap and water or alcohol-based hand gel. Then also, if you're sick, try to stay at home and don't share utensils, drinking glasses, towels, or other personal items with other people. All right, now we're going to talk about safe handling of potentially contaminated equipment or environmental surfaces here at the health department. The pictorial here shows the Caviwipes that we use here at the health department. We have policies and procedures for cleaning and disinfecting of environmental surfaces here at the health department. You can look on the L drive and find all of this information. And when we're cleaning and disinfecting, we want to clean the areas that are most likely contaminated. We want to always use an EPA registered disinfectant, and we want to follow the manufacturer's recommendations. And we can use this Cavicide or Caviwipes on everything. As you can see here, the exam tables in an exam room, the lights, the blood pressure cuffs, counters, everything. Doorknobs, phones, keyboards, everything. But you want to make sure that when you are going to use these wipes, that you wipe the surface thoroughly and then you allow the surface to dry at least 3 to 5 minutes before you go on and use that surface, that exam table, whatever, for the next patient. And we do know that there are other areas in the health department, such as the dental clinic, the lab, that uses equipment that has to be sterilized or disinfected at a high level. That's also things that we do here at the health department. And just remember, disinfect after every patient use. It should not be that you have your clinic schedule so tight that you don't have time to disinfect between each patient. You've got to allow the Cavicide that you apply to the surfaces to dry before you move another patient into the area. But make sure you thoroughly do everything there in the exam room. Remember, any surfaces that the patient has come in contact with, you need to be cleaning. In the TB clinic, when we have a patient in there, even if they come in to sit down in the chair just to take their medicine, we wipe down the surface that they sat on, that chair. We wipe down the countertop in the clinical area where we provided their medicine just because it's part of their area that they were in. This is important, I think, to think about it if you're in a clinical setting. The environmental surfaces need to be clean, and I don't think that our housekeeping people are going to be responsible for doing all of these things. But I know in our clinic, we have a patient in the exam room. There again, I'll try to even clean the doorknob off. You know, when I think about it, as much as I can, I'll clean the doorknob. Any kind of surfaces, again, clean them. All right, the next thing is safe injection practices. We know, as we talked about before, this is going to be an aseptic technique. We're going to be washing our hands before we draw up a needle here. We're never going to reuse a syringe. We're going to use single-use dose vials, safety needles, and we're going to properly dispose of these needles in the sharps container. And it's very important, those of you all who work in a clinical area, to make sure that you check the level in those sharps containers, that the boxes are not so full that when you try to open them up to stick in your next syringe that you actually stick yourself. So watch the levels of those sharps containers and make sure you dispose of the containers and get out a new container. So here at the health department, we do have an employee health immunization plan, bloodborne pathogen exposure plan, and respiratory protection plan for all the employees. We know that when you come to work at the health department, that there are certain things that we're going to ask to make sure that you have when you come to work here, or if you don't have them, we can provide them for you. And we're going to be doing, making sure that the staff have the measles, mumps, rubella, and the tetanus and diphtheria injections or vaccinations. We're going to make sure that all of our patients, or all of our employees that have potential risk for bloodborne pathogens receive the hepatitis B vaccine. And those of us who work in TB also have an annual TB test, and we also do fit testing. We know that, well, this year, just let me say right now, this week of December the 1st to the 7th is the National Influenza Vaccination Week. So we want to stress that it's very important and not too late to get your flu vaccine. Annual flu vaccines are recommended by the American College of Immunization Practices and the CDC. Anyone greater than 6 months or older can take the vaccination, and we encourage you all to do that. The bloodborne pathogen exposure plan, this would incorporate HIV, HBV, and HCV. These are hepatitis B, hepatitis C. There is a protocol on the L drive about all of this. If you don't feel like you know about it, you can call me and I'll talk to you about it, or you can look it up on the L drive, the shared drive, and understand about any of these things we're talking about today. But anybody who has potential exposure to bloodborne pathogens should take the annual training, and again, it's a self-study module, and you'll need to do that and take the quiz. And you should know your risk for exposure and be familiar with the exposure control plan. And if you do happen to have exposure, then you need to let your supervisor know as soon as possible, and she will walk you through what needs to be done if you've had an exposure, he or she. And I just want to remind you that we do have an infection control committee here at the health department, and we do oversee the infection control activities at the health department. We review the policies and procedures every year. At least one member of our committee has completed the infection control training by the state, and we try to have representation from every area within the health department on the committee. And we also will represent public health at the county-wide infection control committee, which includes EMS, fire, sheriff, and public health. And here are some of the committee members here. We still, when we get cranked back up with meetings, we need to probably see if anyone is interested from school health to be Dorothy Lewis retired, and we need to replace her. So if you're interested, let your supervisor know. And that is it. Are there any questions?